In the last ESMO Breast Cancers Conference, we present an individual patient-level meta-analysis of 2,031 patients with HER2-positive breast cancer to evaluate the association between HER2DX assay and survival outcomes. What we did in this study was to combine 7 cohorts. The cohorts comprise randomized clinical trials, single-arm studies, and observational studies in the neo-adjuvant and adjuvant setting. And we combine all this data in an individual patient-level analysis, and we evaluate HER2-DX risk score, clinical and efficacy data. The primary endpoint for this study was event-free survival, and we used stratified hazard ratio, stratified Cox models to calculate hazard ratios to adjust for the heterogeneity across studies. So among the 2,031 patients included in this study, approximately 80% had T1 and T2 tumors, 40% received neoadjuvant treatment with a PCR rate of 43%, and the distribution of HER2-DX risk score was approximately 50% between both low and high risk groups. So what we saw in this study was like in the univariable analysis, several factors such as HER2-DX risk score, tumor and nodal stage, and PCR status were associated with event-free survival. However, in the multivariable analysis, the only factors who remained statistically significant were HER2-DX risk score and PCR status, regardless of tumor stage, nodal stage, and hormone receptor status. The prognostic value of HER2-DX remained consistent within clinically relevant subgroups. And also, when we evaluate HER2-DX as a risk factor, low versus high, so we observe a clear difference in the Kaplan-Meier curve estimation. At 6 years of follow-up, the absolute difference were between low and high risk groups were greater than 10%, from 82.9 in the EFS rate to 93%, with a stratified hazard ratio of 2.55 and a p-value of less than 0.001. As I told you in this work, so we demonstrate, we prove the prognostic value of HER2-DX, regardless of clinical, the hormone receptor status, the tumor and nodal stage, and the PCR status. And the impact of the results are that HER2-DX, this assay, can help to better identify patients who may benefit from a less intensive treatment and those who could benefit from more aggressive approaches. Now we are going to analyze more in detail this data, to also play with different treatment regimes and see the association within the different treatment strategies. And we are planning to publish a manuscript soon with the results of this work.